One thing we've learned with telemedicine over the past 3 years is a distinction, a difference, if you will, between what people call telemedicine and what people call telehealth. So what's the difference? Telemedicine, and this is true in the human case as well, is limited to when a doctor, a licensed doctor, practices medicine through a tool that's virtual. That is, the patient's not in the room or in the physical location that the doctor's in. And it involves 4 things. It involves diagnosing a condition, which is limited under Practice Acts to something a veterinarian can do, issuing a prognosis, what's going to happen to the pet if some treatment is or isn't followed. 3rd, prescribing medications for the pet. And 4th, conducting surgery. Those are privileges that only licensed veterinarians have in the United States. That's true across all 50 states plus DC. That's telemedicine. Telehealth is what we have more of than anything else across the country, and some very successful firms, many of whom are part of VVCA, where non-doctors, which could be veterinary nurses, veterinary technicians, or other pet care experts, are able to be reached through Zoom, through FaceTime and other electronic tools, and give guidance to a pet owner who has a call, often a brand new pet owner, classically a Gen Z or a millennial that got a pet during COVID, and something's happening with their gorgeous little puppy and they're not sure what it means, and they're not experienced. They don't have a guidebook in front of them, and they call a telehealth company. And in that case, remember what they can't do. That person on the phone who's not a doctor can't diagnose, issue a prognosis, or prescribe medications. But they can give you guidance. They can give you a sense about what others have experienced, what a lot of literature shows, what you might call decision support. My dog's doing this. Can you give me some sense of what might be happening? They can't say in that telehealth engagement, this is the condition your dog has, this is what you must do, unless you're a veterinarian. But about 70% of the calls to many companies, they've shared data with the VVCA, indicates that that's what they're trying to get, just some general background knowledge, how to get started. And in some cases, encouragement or discouragement, should I get in to see a doctor right away? Many times the telehealth companies say, you need to hang up the phone and go to an emergency clinic right now. Often they say, no, that you're going to be fine based upon our experience and what the research and literature shows. You're free to go to a doctor, but overall, this is the situation that many have faced that seems to apply to your case. So if you wonder how non-doctors get to make electronic contact with pet owners and pets, they can. It's legal. It's not limited to doctors, but it has to be in this category of telehealth, not those 4 specific privileges and powers that are limited to veterinarians.